So they go and they're talking about, automatically they're talking about, putting in a port and doing chemo and things of this nature. And I'm like, whoa, 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 whoa. Everything's too fast. I'll admit this. It took me it took me, and I think I still struggle today, as far as with the diagnosis. But, after going through 3 rounds of chemo, I'm pretty sure, I'm pretty well in the knowledge of, I'm a cancer patient, right? But it took me a while to get there. Um, so I go into surgery. My first thing was I had to get a stent put into my pancreas because um, my urine and things wasn't traveling like it's supposed to, this and that. So now my first surgery was a stent placement into my pancreas, but that way so my bodily fluids can flow. My liver, my pancreas, and all that. That's my first operation. The second operation was a chemo port, which you guys, those of you who are listening can't see it, but the ones that are watching can see it. You can see the scar right here in my upper jugular here, and it's one right here in the middle of and the port is definitely right here in the middle of my chest. And the port is for when I go in to do blood work. Um, they just stick a needle in my port in my chest, and they draw blood that way versus trying to find a vessel in my arm, which is a lot easier. It hurts. I ain't gonna lie, it hurts. But it only hurts for a second or two. It's not really that big of a deal. Um, but so the schedule that my oncologist has for me is that I'm going to do the normal 12 rounds. I'm on the most aggressive form of chemo, which is the Florinox, which is 3 medications that I take when I get infused. But we'll get into that in a second. But I'm on the most aggressive form of chemotherapy. So hopefully they can attack it, they can shrink it, and I can have Whipple surgery here down the road. Um, so my first round of chemo was nerve wracking because I was so scared before, right? Um, so I go to the first round, and uh, I didn't really have any effects. Let me get back. I missed a part. Let me get back. My schedule is 12 rounds of Florinox, right? Um, After the first 6 rounds, they're going to go back in. They're going to do another CT scan or either probably a PET scan to see if the chemo is taking any effect, if it's doing anything for the mass that's on my pancreas. If it is, then what they'll do is I'll do the other 6, and then they'll schedule me for my surgery, and we'll go from there, right? If after 6 rounds of chemo or the most aggressive form of chemo, after 6 rounds, I'm faced with this, and after 6 rounds, and they rescan, and it doesn't do anything. If the cancer hasn't spread or whatever, I'm faced with a decision at that point. Because if 6 rounds of the most aggressive form of chemo does not shrink this tumor, I'm faced with it. I'm faced with either stopping